What's up, guys? The Basketball Doctor is here. We're going to go over some jumper's knee Q&A. My name is Dr. Marco Lopez, co-founder of the Basketball Doctors.
And I'm Dr. Gabe Ignacio. Like you mentioned, we're just going to go over the Q&A questions that you guys asked us in previous posts and across our social media. So if you have any other questions regarding jumper's knee or anything in general, make sure to comment below, ask them below. We'll get to them either if we can answer them in the comments, we'll answer them there. But if we feel like they need more in-depth answers, we'll break it down in our next Q&A video, essentially.
Perfect.
Besides that, we're going to get into it.
All right, so the first question is by Clarity00. My jumper's knee won't go away. I had debridement last 2017, but the pain returned. Although it's less than before, but this has been a big problem as I can't play straight days. I play once and it flares up again. 2 to 3 months for the pain to subside. Do you think I should have surgery? What do you think, Gabe?
Gotcha. So it sounds like he's been dealing with this tendinopathy issue for several years now, and like a debridement is pretty much just like a cleanup of the tendon. Maybe they saw like thickening of the tendon. Sometimes surgeons, we don't see it that often, they go in there and shave it down a little bit, clean up some of that scar tissue or whatever they found to hopefully let that patellar tendon move a little bit better and accept more load. To answer this question of should he have surgery, for us, surgery is always last resort. You could talk to other people, maybe they might have different opinions, but for his specific case, just sounds like maybe he didn't do proper loading or proper rehab. The fact that he tried or has played multiple days and then that's what causes it to flare up really badly is more of like a tendon capacity or tissue load capacity issue that's not allowing him to play. And when he overdoes it, that's what causes him to have that setback of not being able to perform or pretty much be pain-free. So that's our first initial thoughts, is what is he doing for current rehab? Is he doing proper tendon loading? Is he doing proper rehab of adjusting like below and above the chain, of making sure he's strong and stable at the hip, has an ankle? Does he have like normal mobility above and below as well? And then what is he doing to increase the load and tissue capacity at the knee itself? So that's kind of my initial thoughts, Marco. Anything you're thinking about?
I think Gabe kind of summed it up. Making sure we're doing rehab. Just debridement and you just resting is not going to be the solution. You got to, work on those muscles, work on those tendons, getting them stronger. We have a great online jumper's knee rehab program. Click the description below. It's in our website as well. But you have to be doing your rehab, and to, like Gabe said, just slowly build up your low tolerance. Maybe, when he plays one game and he can't play again, maybe he's just overdoing it. Maybe you play 10, 15 minutes, the next day 17 minutes, 19 minutes. You just slowly load it up. So I think there's some kind of load management issue there. But like Gabe mentioned as well early on, surgery should be kind of like the last resort. It's always going to be there. You want to just do other treatments like Gabe mentioned, like even maybe some PRP or maybe even finding out if he really has jumper's knee or not.
Yeah, also very true. Yeah. There's so many things that we need to unravel with that stuff. But there is other conservative options. Marco mentioned PRP. There's like a thing called Prolo, where you cause like aggravation at the tendon by the injection, which can restart the healing process. But yeah, you might not even be dealing with jumper's knee. So hard to say, but from the question that he asked, that's kind of where we would go, is like, it sounds like it's just like a ramp up problem and maybe like a improper rehab type of thing. So the next question is it's from Sparkling571. They said, hello, I'm really confused. I stopped playing and I'm doing recovery right now. I started with Spanish squat isometrics and then over the weeks progressed to some other slow, heavy exercises, but I still have pain. It won't go away. Can you guys help me out?
Yeah, that's a great question, and I think I'll kind of phrase it with the question that we did in the previous one, is let's find out if they truly had jumper's knee versus patellofemoral pain syndrome, because they're very similar in presentations, but also at the same time they're very different. Patellofemoral pain has a wide variety of presentations. It might be around the kneecap, below the kneecap, out to the side of the kneecap. Jumper's knee is going to be more right in the base of the tendon, and the reason I ask that is because the treatment will vary between patellofemoral and jumper's knee. Patellofemoral, It's going to be much different as we have to look at even different components, making sure we're in different positions. Maybe we don't overload it. As opposed to jumper's knee, we want to kind of get that tendon stronger and stronger. But with patellofemoral, we might not want to overload it because it might just be irritable in that kneecap area. Another thing is I kind of would also want to know like what other exercises have they been doing besides the Spanish squat. You know, we have not to mention it again, but we have a great online jumper's knee rehab program that kind of shows you it's not just the Spanish squat. We're working on the hip, we're working on the ankle. And another thing is, how are you properly, like Gabe mentioned in the previous, ramping up to go back to sport? You know, if they're in full recovery and they're not doing any sport, I'm kind of not a big fan. They should be doing some kind of movement, right? Because what happens if you don't do any movement and you're just doing the Spanish squat, the tendon just gets a little weaker, capacity decreases, and then when you go back, you're just gonna flare it up. What do you think?
Yeah, I think if Spanish squats and heavy loading of the tendon causes more pain or isn't working, you are likely dealing with something different. And if it is PFPS or patellofemoral pain syndrome, like Marco mentioned, they present very similarly, but the rehab program and treatment is very different. Like what we would do for jumper's knee would actually irritate and cause problems for patellofemoral pain. So we always tell people like make sure you are actually doing what you need to be doing and not just, oh, I heard this was good, let's do that. I think that's the beauty and the issue of the internet, social media, and everything. That's why we're always very strict on making sure you're actually dealing with jumper's knee, because if not, this can happen where you're doing heavy knee, like aggravating activities because we do need to load that tendon. But then if you're not dealing with that and you're dealing with patellofemoral pain syndrome, this is going to actually flare up your problem even more. So that's pretty much where we're trying to show you guys with this question, is that the source of your knee pain can come from so many different areas and sources, and you really got to make sure you're getting properly evaluated by the right people and get on the proper rehab program. If something isn't working for you, and this person does a great job of like reaching out, trying to figure out what actually is going on rather than just like blindly just keep going, you know. So I think there's a lot to unpack with this one, but it's important. It was a good question to ask because it isn't the first time we've seen people like, oh, I'm doing this plan, or like I've tried this and it isn't working, and then we evaluate them and they're like, oh yeah, you're actually dealing with something completely different. So just trying to make sure if something isn't working for you, you're proactive on trying to figure out what the next step is.
For sure. And we see a lot of times like, hey, Spanish squats are the best for knee pain, but like Gabe mentioned, it depends on what your knee injury is. So always get evaluated first of all, you know. And that's why we work with people online and in person. We see a lot of people just for one time too. It's just an evaluation. We give them some stuff like, hey, you really are dealing with patellofemoral pain, or you're dealing with jumper's knee, or you might be dealing with like a fat pad issue. There's so many things around the knee joint that might be causing your pain. So evaluation is key. Find out, like Gabe said, is what's going on. There's no one exercise that's gonna fit all, or don't, blindly, go into doing these exercises because you saw. Make sure you are dealing with the right diagnosis, and that's gonna lead us to that specific kind of treatment plan that we have specific for you.
Obviously, diagnosis is important, but we treat impairments and movement dysfunction. We never really treat just the diagnosis. Obviously, it helps with giving information out and giving you guys rehab programs. But when we work with people, we're very much on like impairment-based treatment.
Yeah, for sure. And that's gonna lead to that specific treatment for you, as opposed to like, hey, let's just throw in these bunch of exercises. So, like Gabe mentioned, let's just first figure out if you truly have jumper's knee. And then from there, let's also figure out, what specific impairments you have. Maybe you're doing the right exercises, but you're not loading up, slowly back to sport.
We could go for days about different diagnoses and how to treat them, but for us, we come out with these online rehab programs because it can reach a wide amount of people. But like Marco mentioned, our true bread and butter is when we are actually able to talk to someone one-on-one or work with someone one-on-one online or in person. We just see too many clinics where they do the cookie cutter approach, where it's like, hey, this is what the diagnosis they came in with, here's your exercise program, and it's the same for everybody. Versus when you work with us, we really try to figure out what truly you're dealing with, what your goals are, and then we come up with a treatment plan and plan of care. And that's when you want to work with a therapist or whatever rehab specialist or strength conditioning coach or personal trainer, that they're really working with you to build a plan that works for you and get somewhere so that you meet your goals and stuff like that. So yeah, just our 2 cents and a little bit of a soapbox.
Yeah, for sure. All right, so let's go to the next question. Is by Cole 3800. How long should it take to recover from jumper's knee when I'm doing rehab? What do you think, Gabe?
Yeah, I mean, it's a great question. We get asked that all the time. I mean, it's a common question for an injury. It's like, how long am I going to be out for? When do I expect to come back? Jumper's knee or any like patella or like tendinopathy issue, it really depends on the severity and what stage you are with it. We're going to be really generic with what we give. Marco can go into a little bit more detail if he wants to. But generally what to expect is in those first 2 to 4 weeks of doing proper rehab and proper recovery, you should see a significant reduction in like your pain and significant increase in like your function with like daily activities. So first 4 weeks is really focused on like activities of daily living, making sure the pain is gone with rest, pain is gone with like walking, stairs, like your normal day life stuff. After that, the next, let's say 2 to like 4 to 6 weeks is a gradually ramp up into like more strengthening, more sports specific movement, plyometric training, things like that to overload the tendons so that when you go back to like higher level activities, whether it be weightlifting, practice, sport, games, tournaments, your tissue is ready to withstand that increased load. So generally from that time frame, we expect someone to fully recover from this jumper's knee tendinopathy issue somewhere between like 6 to 10 to 12 weeks, depending on the severity and if you have no setbacks. It's hard to give time frames just because every person is different and their journey is different. So it's very much like how you respond to rehab and how you're going about it. So that's a very generic answer. So that's how we're going to answer that question. Marco, I don't know if you want to go into more detail.
Yeah, I mean, Gabe mentioned it depends on what stage you're in for your tendinopathy. You know, if you had it for a long time, most likely your rehab's going to take a little bit longer. And also doing the right rehab, you know, having that tailored approach, you know, what exactly are we missing? What are the key things that we need to look for? Some of the metrics that Gabe mentioned that we like to use is sometimes, a lot of times with jumper's knee, you know, especially during season or even now, I guess off season is probably worse than season because there's so many AAU games, but we look at different metrics like, hey, how many games were you able to play or how many minutes were you able to play without the pain to flare up? Or, you know, after you played, how low was the pain? Did it go from a 5 to a 3? So little different metrics, even though your pain is still there, your functional activity has improved. You're able to play a little bit longer, you're able to move a little bit easier, you're able to jump. So there's different factors, but a lot of it too, you know, it comes down to, like Gabe mentioned, is jumping on it early on and really finding out, you know, I think it comes down to like a tendinopathy. It's not, you know, just like, oh, I injured my ligament. You know, we have specific timelines. A tendinopathy is, you know, every tendinopathy is different. You know, we don't know what the changes are in the tendon itself and how you present differently, but it all depends on, you know, the different stages you're on, how long you've had it. But we usually tell people you got to start early and start often. That way you address it early on.
Yeah, I think a good example of that was, I think, Kawhi Leonard when he was with the Spurs with his quadriceps tendinopathy. He tried to come back and like ended up not coming back, and it's like his ebbed and flowed like crazy. So it's like you go case by case, and there's some people that can come back a lot sooner. Some people like Kawhi Leonard where it took him a long time, where he tried to get back and it didn't feel right. And there was like a whole thing where he felt like his staff wasn't looking out for his best interests. Like there was a conflict between his team versus the Spurs sports team. So like Marco mentioned, it all depends on who you're working with and how you're going about your rehab and recovery. It's very different than like a more, like what he said, like a ligament sprain or a bone break. You have specific timelines for healing properties. Tendinopathies can vary very much depending on what you do day to day type of thing. Pain isn't like, oh, I'm tearing something or something's actually happening. your body's just warning you that there might be something. So that's why with tendinopathies, we're okay with you working through some discomfort. Especially with this one, this is one where you need to work through some discomfort to make improvement.
Exactly.
But for the most part, don't normalize pain. If you're in pain, please get evaluated. But just like when you work with us, it's hard to do rehab completely pain-free. Obviously, there's some things where you need to be completely pain-free. But again, we're going into a little soapbox again.
Yeah.
But yeah, that's kind of where we want to educate you guys about every source of pathology is different.
Yeah, and then like Gabe mentioned, every pain's different too. We have the sharp pain, soreness, but tendinopathy, honestly, from our experience, it's going to be kind of painful. Unfortunately, it's not going to be this pain-free experience. There's going to be but to a certain extent. I like to keep it at that 3 level when we're working out. If it's like a 9 out of 10, then obviously we're doing something wrong, But there is going to be a little discomfort. It's not going to be super pain-free early on in the rehab process.
Yeah, but that's pretty much wrapping up our questions for jumper's knee. We want to highlight those questions with this particular Q&A. We'll come out with another Q&A relatively soon. There's a bunch of questions on knee, other knee issues, but we want to separate them. We want to focus more on jumper's knee with this one. Like I said, if you have any questions specifically about what we talked about, ask them below in the comments, send us an email, or if you have random questions, feel free to put them here as well. Like we said, we'll try and answer them in the comments below. If we feel like it needs to be more in depth, we'll do it in our next Q&A.
Awesome, guys. Yeah, so like Gabe mentioned, comment below, hit the like, share, subscribe button. If you guys have any detailed questions, send us an email. We are based out of Southern California, and we could also work with people virtually as well. But yeah, hopefully you guys learned a lot about our jumper's knee Q&A question, and check out our online jumper's knee rehab program as well.